Okay, sir. Good afternoon, everyone. It is my privilege and honor to introduce Dr. S.K. Singh, sir. Today's our guest. Dr. S.K. Singh holds MBA, MA, MPA, MPhil, and PhD in yoga. Sir has 22 years teaching and administrative experience. He has extensive research record with more than 200 research papers, 11 books, and 12 conference proceedings and paper presentations. He has guided to PhD scholars and MPhil students. Sir has got 4 patents. One is for utility from South Africa and UK and 3 for designs. Sir has organized various national and international conferences and also delivered several invited talks and guest lectures and chaired sessions. Sir is holder of multiple
सर
prestigious
लेटर आ जाएगी सर। हेलो,
recognitions,
लेटर आ
including
जाएगी। मैं बोल दिया हूँ बनाने के लिए, लेटर आ जाएगी आपकी।
including Best Teacher Educator Award of NCTE and Government of India. Also Global Research Award Dubai, Young Scientist Award, Sports India Award and many more national and international level. Sir has served as Director, School of Education Science, Head Department of Physical Education, University Director of Sports, Coordinator of IQAC SES, NAC peer team member, and has held prestigious university positions, including Member of Management Council, Senate member, Chairman of Board of Studies. So today we have such a great personality person as a speaker. Once again, welcome, sir. Thank you.
हेलो, गुड आफ्टरनून ऑल ऑफ यू।
Good
हेलो।
afternoon.
Good afternoon, sir.
आई एम ऑडिबल?
Yes, sir.
Yes.
Yes, sir.
Okay, so first of all, I would like to share my slide. Okay, wait. So hello, can my slide is visible?
Yes, sir. Visible,
Yes.
sir.
This is moving.
Yes, sir.
Yes.
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 Okay,
Okay.
was so nice. So hello, once again, good afternoon, all of you. So today, the topic of my presentation is cardiac health and wellness, causes and remedies. So actually, all of you will aware that. So today is the cardiac health is very important for all the people, not only in India, around the world, because cardiac problem is the one of the most public health problems in entire world, and cardiac arrest or cardiovascular disease is one of the most common causes of death worldwide. So all of you will aware that. So health is the state of physical, mental, and social well-being, while wellness is the proactive, ongoing process of making choices to achieve a balance, fulfill lifestyle. Together, they emphasize prevention, holistic balance, and conscious self-care. So there are so many types of wellness, so many kinds of wellness, and achieving comprehensive health and well-being require nurturing several interconnected dimensions of our life. So when we talk about the physical balances, so physical balances focus on maintaining a strong body through balance, nutrition, regular exercise, 6 to 8 hours, a good quality of sleep, and routine medical checkup. So when we talk about the mental and emotional well-being, so it involves emotional regulation, stress management through meditations, yoga, participation in sports, recreational activities, entertainment, and actively seeking to cope with the normal pressure of life. The another kinds of wellness is the social and spiritual wellness. So social and spiritual wellness emphasized building a strong, supportive interpersonal relationship in finding a sense of purpose, meaning, and inner peace. So another is the environmental and intellectual wellness. So this relates to creating safe physical surroundings and keeping the mind stimulates through ongoing learning and curiosity. So finally, achieving a healthy work-life balance in academia is notoriously challenging. The profession's inherent flexibility often leads to boundary blurring over work and burnout. Successfully navigating this environment requires deliberate time management, a strict personal boundaries, and a strategic focus on the evaluation metrics in the matter most. So now I would like to focus on the cardiac health because all of you well aware that because this is related to our day-to-day life, and this is one of the most common problems in our country. Even the young populations also suffer from the cardiac health. So we can say that cardiac health is essential for maintaining the efficient functioning of the heart and circulatory system, ensuring an adequate supply of oxygen and nutrients to all body tissues. Good cardiac health significantly reduces the risk of cardiovascular disease, including coronary artery disease, heart attack, stroke, heart failure, and cardiac arrest. So, maintaining cardiac health contributes to increase life expectancy by reducing premature mortality associated with heart related illness. A healthy heart improves physical endurance, aerobic capacity, and exercise performance, enabling individuals to perform daily activities with greater efficiency. So cardiac health play a crucial role in maintaining normal blood pressure, thereby preventing hypertension and its associated complications. So healthy cardiac function support efficient blood circulations, which is necessary for the proper functioning of all organs and body system. So maintaining cardiac health helps regulate blood cholesterol level, reducing the accumulation of plaque in arteries and lowering the risk of atherosclerosis. So uh, good cardiac health contributes to effective blood glucose regulations by improving insulin sensitivity and reducing the risk of diabetes related cardiovascular complications. With healthy cardiovascular systems enhance oxygen delivery to the brain, thereby supporting cognitive functions, memory, and mental alertness. Cardiac health promotes better mental well-being by reducing stress, anxiety, and depressions through improved circulations and regular physical activities. So maintaining cardiac health strengthen the heart muscles, allowing the heart to pump blood more efficiently with less strain. Good cardiac health helps maintain the elasticity and integrity of blood vessels, thereby reducing the risk of vascular diseases. Healthy cardiac function support the immune system by ensuring the efficient transport of immune cells throughout the body. Maintaining cardiac health reduces the likelihood of obesity by promoting an active lifestyle and improving metabolic efficiency. Cardiac health decrease healthcare cost by preventing chronic cardiovascular disease and reduce the need for hospitalizations and long-term medical treatment. A healthy heart enhances workplace productivity by improving energy level, reducing fatigue, and minimizing absenteeism due to illness. Good cardiac health improves the quality of life by enabling individual to remain physically active, social engaged, and functionally independent. Maintaining cardiac health reduce the burden of chronic disease on families, healthcare systems, and society as whole. Cardiac health is essential for healthy aging as it helps preserve physical education, mobility, and independence in older adults. Regular monitoring and maintenance of cardiac health facilities and early detections and management of cardiovascular risk factors preventing serious complications. A healthy heart support optimal kidney function by maintaining adequate blood flow and regulating blood pressure. Cardiac health play an important role in preventing sudden cardiac event through early lifestyle interventions and appropriate medical care. Maintaining cardiac health contributes to improve sleep quality by supporting normal cardiovascular and autonomous nervous system. So we can say that the promoting cardiac health is a major public health priority because it reduces the global burden for cardiovascular disease, improve population health, and support sustainable healthcare system. So here, understanding heart disease is essential for reducing the global burden of cardiovascular morbidity and mortality. So early detection of heart disease improve treatment outcomes and increase the enhance of survival. So awareness of heart disease enables individuals to recognize warning signs and seek timely medical care. So now we focus on the how to diagnose when the heart attack occur or self diagnosis on possibility of heart attack, warning signal of the heart attack. So there are evidence available in our society. So mainly the 60 to 80% of heart attack occurs in the morning, and that this time the hospital is closed, and so several peoples they loses their life during home to hospitals. So the first warning signal is to discomfort of the chest. So participants, you will aware that a heart attack cannot be reliably diagnosed by symptoms alone. However, recognizing the following warning systems help in individual seek immediate medical attentions and improve the chance of survival. So when we talk about the chest discomfort, means a feeling of pressure, tightness, squeezing, fullness, or pain in the center or left side of the chest that lasts for several minutes or comes and goes. So heartburn or burning sensations also occurs in the also is the warning signal of heart attack. A burning sensations in the chest that may be mistaken by acidity or heartburn, especially if it is new, severe, or associated with other symptoms. So another is the indigestion. So unexplained indigestion, bloating, or discomfort in upper abdomen that does not improve the usual remedies may sometimes be a symptoms of a heart attack. So another is the pain in the chest, lightning pain or heavy pain or pressing pain, pain radiating to the left arm, neck, back, or jaw. So chest pain that spreads of the left arm, even in both arms, shoulders, neck, back is a classic warning sign of the heart attack. Another thing is the excessive sweating. So sudden cold sweating or profuse perspirations without physical exertions, particularly in a cold environment. So another is the unusual difficulty in climbing upstairs or difficulty discomfort while walking. So unusual fatigues, discomfort or chest pain while climbing stairs, walking or performing routine activities that were previously easy. So another is the dizziness or light headache, feeling faint, dizzy, and experiencing a sudden loss of balance, sometimes accompanied by weakness. So another is the vomiting or nausea. So nausea, vomiting, or an upset stomach, particularly when accompanied by the chest discomfort or other symptoms. So sudden unexplained tiredness or weakness, especially in older adults and women, which may occur hours to day before a heart attack. So you can see in these slides. So fat deposit in under the blood vessels. So the yellow is the fat deposit in the forms of triglycerides. So triglycerides is one of the components of lipid profile. And another you can see in the red, this is the coronary arteries. So we can say that heart related complications are serious health conditions that develop when the heart or the cardiovascular system is damaged or does not function properly. These complications may arise from untreated or poorly managed heart disease, such as coronary artery disease, hypertension, cardiomyopathy, valvular heart disease, or congenital heart uh, attack. So here, heart attack. So actually, there are several type of heart attack. So major heart related complications include the heart cannot pump enough blood to meet the body needs, and other the symptoms include of heart failure is shortness of breath, fatigue, and swelling of the leg and the ankles, especially in the left leg. Another heart related complications is a heart attack. So attack occurs when blood flow to the heart muscles is blocked or completely blocked, even in the partial blocks. So this is called is the heart attack. So this causes a permanent damage to heart tissues if blood flow is not restored quickly. So here another is the cardiac arrhythmias. So cardiac arrhythmias means the abnormal heart rhythms, including fast, slow, or irregular heartbeats, may lead to dizziness, fainting, stroke or sudden cardiac death. So another is include in stroke. So stroke reduces blood flow or blood clot from the heart block blood supply to the brain. The common in patient with atrial uh, fibrillations and other cardiac disorders. So other is the cardiogenic shock, a severe conditions in which the heart suddenly cannot pump enough blood to the body, often follows a large heart attack and is a medical emergency. So another is the pulmonary edema. Pulmonary edema is the fluid accumulates in the lungs because of left side heart failure, causes severe shortness of breath and difficulty breathing. So another things also comes in the blood clot. In the scientific name, blood clots is the thromboembolism. So this is the stage of blood clots. So blood clots may inside the heart and travel to the brain, lungs, or other organs, can cause a stroke or pulmonary embolism. Another is aneurysm. So aneurysm means the weakening and bulging of the wall of the major artery, particularly the aorta. This in these conditions, a rupture of aneurysm can result in life-threatening internal bleeding. So another types of cardiac complications is valve damage. So all of you will aware that there are four valves in our heart. There are four chambers in our heart. So in heart valve disease may lead to stenosis, means the narrowing, or regurgitations, means leakage. So severe valve dysfunctions can result in heart failure. So another is the ineffective endocarditis. So infection of the heart inner lining or a valve can permanently damage heart valve and lead to heart failure. So another is the pulmonary hypertension. So in pulmonary hypertension, increased pressure in the arteries supplying the lungs and causes a strain on the right side of the heart and may progress to right side heart failure. So one thing is also a chronic kidney disease. So in chronic kidney disease, poor cardiac functions reduces blood flow to the kidney, and heart disease and kidney disease often worsen each other. So there are so many types of cardiac related complications, and this is fatal for our life, fatal for our health. So you can see here the coronary artery disease. So there are actually one thing is very common in the heart. So there are a four chamber in heart. This name is uh, two auricles and two ventricles. The upper part of the heart is the auricles, and the lower part of the heart is called ventricles. So there are two ventricles and two auricles in the heart. So this is called is the left and the right. So another, there are a four valve in the heart, and there are a four main coronary in the heart. So heart affected mostly in the coronary arteries in the heart. So actually you can see in the pictures. So there are mainly four arteries: left coronary artery, Another is the circumflex arteries. This is the circumflex arteries. Next is the left anterior descending arteries, and another is the right coronary arteries. If the blockage occurs in the left coronary artery, so this is more and more dangerous, and this is the fatal. Okay. Otherwise, blockage in the circumflex arteries, this is also dangerous, but not dangerous as compared to the left coronary arteries. So another is the left anterior descending arteries. So this is also important for supply the blood to the body. So arteries supply the blood to the heart. Another is the right coronary arteries. So right coronary arteries is not very serious, but if occur, so stenting is recommended for the people. Now I would like to focus on the heart attack. You can see these slides. So there are three in bottom there are three figure. So this is the normal one, is upper is the normal arteries, next is the partial block, and in the bottom is the complete block. So participant heart attack, also known as a myocardial infections, is one of the leading causes of death and disability worldwide. It occurs when the blood flow to a part of the heart muscles is suddenly blocked, usually due to the rupture of an atherosclerotic plaque and formations of the blood clot. Understanding heart attack is essential because prompt recognitions and timely medical interventions can significantly reduce heart muscles damage, improve survival rates, and prevent long-term complications. The need to understand heart attack has become increasingly important due to the rising prevalence of cardiovascular disease driven by factors such as sedentary lifestyle, unhealthy dietary habits, obesity, diabetes mellitus, hypertension, smoking, excessive alcohol consumptions, chronic stress, and aging factors, populations. So public awareness of the risk factors, warning signs, and preventing measurable enable individual to adopt healthier lifestyles and seek immediate medical attentions when symptoms occur. So early recognitions of common symptoms, including chest pain or discomfort pain radiating to the left arm, shoulder, neck, jaw, back, shortness of breath, cold sweating, nausea, dizziness, and unexplained fatigue is crucial. Rapid medical treatment, including uh, CPR therapy, when appropriate, can restore blood flow to the heart, minimizing permanent damage to the heart muscles and improve patient outcomes. So, understanding heart are emphasizes the importance of regular cardiovascular screening and effective management of modifiable risk factors such as high blood pressures, high cholesterol, diabetes, obesity, and tobacco use. Preventing strategies including regular physical activity, a balanced diet, weight management, smoking cessations, stress reductions, and adherence to prescribed medications play a vital role in reducing the incidence of heart attack. From a public health perspective, increasing awareness about the heart attack contributes to lower healthcare costs, reduce disabilities, improve quality of life, and increase life expectancies. Therefore, comprehensive educations, early diagnosis, prompt treatment, and effective prevention are essential for reducing the global burden of heart attack and promoting long-term cardiovascular health. So when we're talking on this picture, so you can see, so there is a blockage seen in the two arteries. This is called is the partial block. Second is the complete block. So this is the normal arteries where blood pass in smoothly, but in partial arteries, so blood pass not smoothly because these blockage, these fat tissues accumulate in the arteries that create a obstacle for blood flow in the arteries. So completely block means the blood cannot flow in the arteries. In these situations, either at the patient dead, or this can be severe chest pain, or this is the stage of the heart attack. So you can see in this biggest picture, so this is the biggest artery. So either this is the yellow substance. So yellow substance, this accumulate in the forms of triglycerides, and triglycerides is the one of the components of blood cholesterol levels that prevent the blood flow in the arteries, because this blocked to the arteries. So symptoms of MI. MI means myocardial infarction. 1 minute. So actually there are 10 common systems of a heart attack. I already discussed before all of you. So this include the fatigue, dizziness or panting, heartburn, okay, sweating, vomiting, back pain, chest pain, etc., etc. So now we talk about the causes of heart-related problems or cardiac problems. So first, more common causes is the sedentary lifestyle. So you can see here the slides. So this is showing the sedentary lifestyle. So actually, sedentary lifestyle refers to a pattern of behavior characterized by prolonged period of sitting, reclining, or lying down while awake with very little physical activity or energy expenditure. It is one of the most significant public health challenges of 21st century due to its strong associations with numerous chronic disease and premature mortality. According to the World uh, Health Organizations, physical inactivities is among the leading modifiable risk factors for non-communicable disease, including cardiovascular disease, type 2 diabetes mellitus, obesity, certain cancer, and mental health disorders. So, anyone can tell me what is corona is comes under communicable disease or non-communicable disease? Anyone tell me? Participants, I am asking from the participants. Participants, anyone listening me?
Yes, sir.
Yes,
I
sir.
Yes, sir.
okay. So I am asking you. So Corona, COVID or Corona comes under the which types of disease? Communicable disease or non-communicable disease?
Communicable disease.
Communicable disease. Okay. So now you are actively participating in this course. So, although the sedentary behavior and physical inactivity are closely related, they are distinct concepts. Sedentary behavior specifically to the activities that involve an energy expenditures of 1.5 metabolic equivalents or less while sitting uh, or laying down during waking hours, whereas physical inactivity refers to not meeting the recommended level or moderate or vigorous intensity physical activity. So, in simple terms, we can say that sedentary lifestyle means that uh, we spend our life without physical activity or participating in any sporting activities, and this may lead to several types of disease, including cardiac related problem or heart related problem. In modern society, sedentary behavior has become increasingly common due to rapid technology advancement, urbanizations, and changes in occupational and recreational patterns. So you can see in this picture, so many people spend a substantial portion of their day working at computers, attending online meetings, studying, driving, watching television, or using smartphones and other digital devices. So they cannot go to play in the ground, stadium for sporting activities. So here, this also include office employee or often remain seated for 8 to 9 hours a day. Students spend long hours attending classes and completing assignments, and leisure time is increasingly devoted to screen-based entertainment. These lifestyle change have greatly reduced daily energy expenditure and opportunity for movement, contributing to widespread physical inactivity across all age groups. So finally, a sedentary lifestyle is characterized by prolonged sitting. 1 minute. You can see here prolonged sitting, limited participation in exercise or recreational sports, excessive screen time, dependence on motorized transportations, and minimal engage in physical demanding household or occupational activity. Individuals with sedentary lifestyle often use elevators instead of stair, drive distance rather than walk or cycle, and spend considerable time engaged in passive leisure activities. Even individuals who participate in short period of exercise may still be considered sedentary if they spend the majority of their working hours sitting without frequent movement breaks. Consequently, reducing prolonged sitting has become an important component of public health recommendations alongside increasing regular physical activity. So development of development of the sedentary lifestyle influenced by numerous social, environmental, occupational, and behavioral factors. Technological innovations have automated many daily tasks, reducing the need for physical labor. So, urban environments frequently provide limited access to park, walking trails, and recreational facilities, while concern about traffic congestions and safety discourage outdoor activities. The increasing popularity of remote work and online education has further increased sitting time, particularly following the COVID-19 pandemic. In addition, demanding work schedules, academic pressures, family responsibilities, in long-term computing times often leave individuals with insufficient time or motivations to engage in the regular physical activity. The physiological effects of the sedentary lifestyle are extensive. Prolonged sitting reduces muscles contractions, particularly in the large muscles of the legs, leading to decreased glucose uptake and reduced insulin sensitivity. Energy expenditures declines significantly, increasing the likelihood of positive energy balance, and weight gain. Extended period of inactivity also impair blood circulations, reduce the activity of enzymes involved in fat metabolism, and promotes the accumulation of body fat. Over time, these metabolic changes increase the risk of obesity, dyslipidemia, metabolic syndrome, hypertension, and type 2 diabetes mellitus. In addition, prolonged inactivity contributes to endothelial dysfunctions, erythral stiffness, and systematic inflammations, all of which increase the likelihood of cardiovascular disease. So another effect of the sedentary lifestyle in the musculoskeletal systems is also adversely affected by sedentary behavior. Long period of sitting contributes to poor postures, muscle weakness, reduced flexibility, and decreased bone mineral density. These changes increase the risk of chronic low back pain, neck pain, shoulder pain, osteoporosis, and reduced functional mobility. Lack of regular movement also accelerates age-related muscles loss, known as to sarcopenia, particularly among older adults. So, furthermore, sedentary individuals often experience reduced aerobic capacity, diminished muscular endurance, and impaired balance, which may increase the risk of fall and physical disability later in life. So, finally, we can say that sedentary lifestyle has important psychological and cognitive consequences. Numerous studies have shown that prolonged sedentary behavior is associated with higher level of stress, anxiety, depression, and reduced overall psychological well-being. Physical activity limits the release of endorphins and other neurochemicals that improve mood and emotional health. Excessive screen times may also contribute to social isolations, disrupt sleep patterns, and reduce interpersonal interactions. Several research indicates that regular physical activity improves cognitive performance by increasing cerebral blood flow, stimulating neurogenesis, and enhancing memory, attention, and executive functions. Conversely, prolonged sedentary behavior has been linked to cognitive decline and increasing risk of dementia. Priyanka को बोलो. So the another causes is resistance blood pressures. So this is very dangerous because so this blood pressure cannot control after taking the highest recommended dose of hypertension. So before discussion of resistance blood pressure, I would like to say the focus on blood pressure. So participants all of you are well aware that blood pressure is the force exerted by circulating blood against the walls of the arteries as heart pumps blood throughout the body. It is one of the most important physiological parameters and essential for maintaining adequate blood flow in the body. The normal blood pressure ensures the oxygen and nutrients are delivered efficiently to body tissue, and while metabolic waste products and removed. Blood pressure is determined by two primary factors. The first factor is the amount of blood. थोड़ी देर बात कर दे दो. Amount of blood pumped by the heart and the resistance offered by arteries. When the heart contracts, it pumps blood into the arteries, producing the highest pressures known as systolic blood pressures. When the heart relaxes between beats and fulfilled with blood, the pressure falls to its lowest level, known as diastolic blood pressure. Blood pressure is therefore expressed as two numerous. For examples, 1 to 80 mg Hg. Hello? 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 My voice is clear or not?
Clear, sir. Clear.
Participants, I am asking
Yes.
you. So
Yes,
someone
sir.
is talking, someone is talking to me or not?
Yes.
Your voice is clear, sir.
It is clear, sir.
It is clear?
Yes,
Okay,
sir.
1 minute break. सर मेरा एक लेक्चर चल रहा है, मैं आपको 6 बजे के बाद कॉल करता हूँ. 6 बजे के बाद कॉल करता हूँ. So sorry for interruptions. So we are talking about the blood pressures because every 6th to 7th people they are suffer from the blood pressures nowadays. So this is one of the common lifestyle disease in our society. So this is not only contributes to heart related problems but also this adversely impact the several organs in the body. So uh, we measure blood pressure using a device called is the sphygmomanometer along with a stethoscope or an automated digital blood pressure monitor. The measurement is recorded in multimeters of mercury. This is called is the mmHg. Accurate blood pressures measure should be performed after the individual has rested for at least 5 minutes while seated comfortably with the arm supported at heart level. So maintaining normal blood pressure is essential for overall cardiac health or cardiovascular health because blood pressure is one of the type of cardiovascular disease. Okay, so blood pressures that remains consistently above the normal range is called hypertension or the high blood pressures. So while blood pressure is consistently below the normal range, this is the low blood pressures or hypotensions. So both conditions can adversely affect the health. Hypertension is the major risk factors for heart attack, stroke, heart failure, kidney disease, and the vision loss, whereas severe hypotension may lead to dizziness, fainting, shock, and inadequate blood flow to the vital organ of the body. So several factors influence blood pressures, including age, genetic factors, body weight, physical inactivity, dietary habits, stress, smoking, alcohol consumptions, medications, and underlying medical conditions. So excessive salt intake, obesity, physical inactivity, diabetes mellitus, and chronic stress are among the most important modifiable risk factors for
Right, sir?
hypertension.
Oh,
Yes, 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 please.
चलो चलो पाठ
Pratibha,
अरे
Pratibha madam,
देखो प्रवृत्ति का
so you want to say something from me? You asking from me something?
हो
Pratibha madam, I am asking you. So,
आता
hello?
नाही नाश्त्याला थांबणार ना म्हणून कंटाळा. नाही पाहिजे तेवढं
कसं आहे डायरेक्ट निघाले की कुणाला
हो,
लागलं
चालेल.
लागलं काय
बरं आहे जागा बसतो आता मग
Pratibha madam, Pratibha madam, are you listening me clearly or not? I am asking from you.
मग काय करायचं उतरूया
हो, पटते ना.
शेवट होतं ना ग.
Pratibha madam, हमें लगता है आप किसी से बात कर रही
जागा
है.
नाहीये.
I think you talk to others, so please mute yourself, madam.
इथे बघा शर्मिला इथे एक होती बसले
So regular monitoring of blood pressure is essential because hypertension often develops without noticeable symptoms, and it's therefore referred to as the silent killer. So BP is the silent killer. So it not be controlled for long term. So it may increase the risk of heart related problems or heart disease. So early detections and appropriate management through lifestyle modifications and medications when necessary can significantly reduce the risk of cardiovascular complications. So blood pressure is the pressure exerted by circulating blood system in wall of the arteries and vital indicators of the health. So when we talk about the resistance blood pressure, so this is more and more dangerous, and this contribute to the heart attack, a stroke, kidney failure, and several damage of the body organs. So several parts of the body damage due to resistance blood pressures, because this so in resistance blood pressure, peripheral vascular resistance, also known as the systematic vascular resistance, is the resistance that blood encounters as it flow through the body blood vessels, particularly the small arteries and arterioles. It is one of the principal determinants of blood pressures. Blood pressures depend on two major factors: cardiac output, means the amount of the blood pumped by the heart per minute, and peripheral vascular resistance, the resistance offered by blood vessels to blood flow. When blood vessels become narrow, means vasoconstrictions, resistance to blood flow increase. As a result, the heart must generate greater pressures to pump blood through the circulatory systems, leading to an increase in blood pressures. Conversely, when blood vessels widen, resistance decrease, allowing blood to flow more easily and resulting in lower blood pressure. The relationship between blood pressures, cardiac output, and peripheral resistance can be expressed by the following physiological equation. The peripheral resistance is influenced by severe physiological and pathological factors. The diameter of blood vessels is the most
Sir,
important.
you are not. आवाज नहीं आ रही सर.
आवाज नहीं आ रही क्या अभी? अभी आ रही है आवाज? हेलो?
हाँ आ रही है सर, आ रही है सर।
क्लियर है सर, क्लियर अच्छी है।
उनको आ रही है कि नहीं? सर हो सकता है आपका रेंज क्लियर नहीं हो सर।
नहीं सर, हो गया सर. ओके ओके, सॉरी सर.
Okay. So several conditions of peripheral resistance, including hypertension, obesity, smoking, diabetes mellitus, atherosclerosis, chronic stress, excessive dietary sodium intake, and physical inactivity. These factors promotes vasoconstrictions or damage the aerial walls, making them less elasticity and increasing the workload of the heart. In contrast, regular physical activity, a healthy diet, maintaining an appropriate body weight, reducing sodium intake, stress management, smoking cessations, and medications such as vasodilators and sudden hypertensive drug helps reduce peripheral resistance, lower resistance, decrease the workload on the heart, and contributes of the better blood pressure control. So another there is a So another is the exercise-induced hypertension. So this is actually um, mm, uh, as per the doctor suggest that so exercise that helpful to control the blood pressures. But in some cases, the blood pressures increase or cannot control due to the exercise or the physical activity. प्रतिभा पतंगे मैडम, आप अपने आप को थोड़ा म्यूट कर लीजिए. सो आई एम टॉकिंग टू प्रतिभा मैडम. हेलो.
Hello,
हाँ, यस यस.
sir. Moon. Yes, sorry, sir.
आप प्रतिभा मैडम को बोलिए ना, म्यूट कर लेंगे वो.
Yes, sir. Yes.
ओके. सो प्लीज रिक्वेस्ट हर टू म्यूट herself.
Yes.
So exercise-induced hypertension has become increasingly important topic in cardiovascular medicines, sports medicine, exercise physiology, in public health because it represents an exaggerated raise in blood pressures during physical activity, even in individual with normal resting blood pressure. Although a temporary उनको फोन कीजिए मैडम को, सुन नहीं रहे. Although a temporary increase in blood pressure during exercise is the normal physiological response that allow the body to meet the increased oxygen and nutrients demand of working muscles in uh, excessive elevations in blood. So although uh, temporary increase in blood pressures during exercise is normal physiological response allowed to body to meet the increased body and blood pressure is considered abnormal and may indicate underlying cardiovascular dysfunctions. So, understanding exercise-induced hypertension is therefore essential for the early identifications of individuals who are at increased risk of developing chronic hypertension and cardiovascular disease. The need to study exercise-induced hypertension has increased because cardiovascular disease remain the leading cause of death worldwide. Hypertension is the most important modifiable risk factors for heart attack and heart failure. So research shown that individuals who demonstrate an exaggerated blood pressure response during exercise are more likely to develop resting hypertension in the futures. Therefore, exercise-induced hypertension serves as a early clinical markers that can identify cardiovascular risk before conventional resting blood pressures measurements become abnormal. The another important reason for understanding exercise-induced hypertension is its role in the early detection of masked hypertension. Masked hypertension refers to the conditions in which an individual has normal blood pressure reading in a clinical setting but experiencing elevated blood pressures during daily activities or exercise. So these individuals may remain diagnosed for many years if only resting blood pressure is measured. Exercise testing provides valuable additional information about cardiovascular functions and may reveal abnormalities that are not apparent during routine clinical examinations. Early diagnosis enables timely interventions through lifestyle modifications and medical management, thereby reducing the risk of future cardiovascular complications. The exercise in induced hypertension is also important because it provides valuable insight into vascular health. During normal exercise, blood vessels dilate to accommodate increased blood flow to active muscles. However, in individual with exercise-induced hypertension, impaired in endothelial functions, increased arterial stiffness, and abnormal vascular resistance prevent adequate vasodilatations. These abnormalities increase the workload on the heart and may accelerate the development of atherosclerosis. And atherosclerosis means hardening of the arteries and other cardiovascular disorders. Underlying these physiological mechanisms help clinicals and researchers develop effective preventive and therapeutic strategies. The identification of exercise-induced hypertension is particularly important in athletes and physically active individuals. Athletes are generally considered healthy because of their high level of physical fitness. However, some athletes exhibit an exaggerated blood pressure response during exercise despite having normal resting blood pressure. Without appropriate screening, these individuals may remain unaware of their increased cardiovascular risk. Regular exercise testing allow sports physicians to identify athletes who requires further cardiovascular evaluations before participating in high intensity training or competitive sports, thereby improving athletic safety and reducing the risk of exercise-related cardiovascular event. The need to understand exercise-induced hypertension is equally important in middle-aged and older adults. Aging is associated with reduced arterial elasticity and increased vascular stiffness, both of which contributes to exaggerated blood pressure response during physical activity. Older adults with exercise-induced hypertension have a greater likelihood of developing sustained hypertension, left ventricular hypertrophy, heart failure, and stroke. Early identifications of these individuals allow healthcare professionals to recommend appropriate exercise program, monitor cardiovascular health, and implement preventive measures that improve long-term outcomes. So we can finally say that exercise-induced hypertension also has significant implications for exercise prescriptions and rehabilitations. Exercise in universally recommended for preventing the and managing hypertensions and cardiovascular disease. However, individuals with exaggerated blood pressures response requires carefully designed exercise programs that balance the benefits of physical activity with cardiovascular safety. Understanding exercise-induced hypertension enable physicians, physiotherapists, exercise physiologists, and fitness professionals to prescribe appropriate exercise intensity, durations, and progressions with minimizing potential cardiovascular risk. The individual's approach enhance both the effectiveness and safety of exercise preventions. So from a public health perspectives, understanding exercise-induced hypertension contributes to the prevention of chronic disease and reductions of the healthcare costs. Cardiovascular disease plays enormous economic difference on healthcare systems through hospitalizations, long-term medications use, rehabilitations, disability, and premature mortality, identifying exercise-induced hypertension before the onset of permanent hypertension allow for early lifestyle interventions, including regular physical activity, healthy dietary habits, weight management, smoking cessations, stress reductions, and sodium restrictions. These preventive measures reduce the incidence of cardiovascular disease and improve the population's health. So another is the hypertension. This is the nocturnal blood pressures. So this is also very dangerous for our life because the blood pressures raises during the sleep. Okay, so we cannot measure during the sleep. So there is the general perceptions in our society. So during the sleep, blood pressures is reduced. But in case of nocturnal hypertension, the blood pressures is increased while you sleeping. So nocturnal blood pressures refer to the blood pressures measured during sleep, typically between 10 p.m. to 6 a.m. under normal physiological conditions. Blood pressures decrease during sleep because of reduced sympathetic nervous system's activity, lower heart rate, decreased cardiac output, and increased parasympathetic activity. This normal reductions in blood pressures during sleep is known as the nocturnal blood pressures deep or nighttime deepening. The assessment of nocturnal blood pressure is an important component of 24 hours ambulatory blood pressure monitor because it provides valuable information about cardiovascular functions that cannot be obtained from the office blood pressure measurement alone. Nighttime blood pressure is considered or stronger predictors of cardiovascular disease, stroke, chronic kidney disease, heart failure, and overall mortality than daytime blood pressure. A healthy individual normally experience a 10 to 20% reductions in systolic blood pressures during sleep compared with daytime values. Individuals who demonstrate this normal decline are referred to as deeper. When the nighttime blood pressures falls by less than 10%, the individual is classified as a non-deeper. Some individuals may experience an increase rather than a decrease in blood pressures during sleep, or conditions known as reverse dipping or a riser pattern, while other may have to excessive reductions greater than 20% refers to a extreme dipping. The abnormal nocturnal blood pressure patterns are associated with increased cardiovascular risk. Non-dipping and reverse dipping patterns have been linked to hypertension, left ventricular hypertrophy, coronary artery disease, stroke, chronic kidney disease, diabetes mellitus, obstructive sleep apnea, and increased all-cause mortality. Persistent elevations of nocturnal blood pressures place additional stress on the heart and blood pressures, accelerating vascular damage and target organ injury. So several factors influence nocturnal blood pressures, including age, obesity, diabetes mellitus, chronic kidney disease, autonomic nervous system dysfunctions, excessive salt intake, alcohol consumptions, uh, smoking, stress, poor sleep, and sleep disorders such as obstructive sleep apnea. So, certain medications and irregular sleep schedules may also alter normal nocturnal blood pressure pattern. So, here nocturnal blood pressures is measured most accurately using 24 hours ambulatory blood pressures monitoring, in which uh, an automated blood pressures monitor records radiating at regular intervals throughout the day and night, while the individuals continue normal daily activities and sleep at home. So this method provides detailed information regarding daytime blood pressure, nighttime blood pressures, morning blood pressure surge, and uh, circadian blood pressures variations. So maintaining normal blood pressure, nocturnal blood pressure is essential for cardiovascular health. Lifestyle modifications such as a regular physical activity, maintaining healthy body weight, reducing the dietary sodium intake, limiting alcohol consumptions, avoiding tobacco use, improving sleep, daily manage stress, and adhering to prescribed antihypertensive medications help maintain healthy nighttime blood pressures. In some patients with hypertension, physicians may recommend taking antihypertensive medicines at a specific time to improve nocturnal blood pressure control, depending on the individual clinical conditions and current evidence-based recommendations. Now, diabetes. So, diabetes is not enemy for the heart. This is also enemy for the all organs of the body, because the type 2 diabetes is adversely impact of all type of the body organs. So, friends, all of you will aware that you can see here in the pictures. So, diabetes mellitus is a chronic metabolic disorder characterized by the persistently elevated blood glucose resulting from defects in insulin secretions, insulin actions, or both. Insulin is a hormone produced by the beta cells of the pancreas, and its primary functions is to regulate blood glucose level by facilitating the uptake of the glucose into body cells for energy productions. When insulin is absent, insufficient or ineffective glucose accumulates in the bloodstreams instead of entering the cell, leading to hyperglycemia. Diabetes mellitus is one of the most common non-communicable disease worldwide and is a major cause of cardiovascular disease, kidney failure, blindness, nerve damage, lower limb amputations, and premature mortality. This affects individuals of all age and has become a significant public health challenge because of increasing obesity, sedentary lifestyle, unhealthy dietary habits, and population aging. So, actually, when we talk about the types of diabetes, so diabetes are there are three types of diabetes. So, type 1 diabetes, three type of diabetes are type 1 diabetes, type 2 diabetes, and gestational diabetes mellitus. So, in type 1 diabetes is an autoimmune disorder in which the immune systems destroy the insulin producing beta cells of the pancreas. As a result, little or no insulin is produced. It usually develops during childhood or adolescence but can occur at any stage. Individuals with type 1 diabetes require lifelong insulin therapy. Type 2 diabetes is the most common form of diabetes, accounting for approximately 90 to 95% of all cases. It develops when the body cells become resistant to insulin and the pancreas cannot produce sufficient insulin to maintain normal blood glucose level. Risk factors include obesity, physical inactivity, unhealthy diet, family history, and aging. So gestational diabetes only occurs in the ladies, in the women. So gestational diabetes developed during pregnancy in women who did not previously have diabetes. It usually resolved after childbirth, but increase the risk of developing two-type diabetes later in life in both mother and mother and the child or the baby. So there are several causes of diabetes. Is the genetic predispositions, obesity and overweight, sedentary lifestyle, unhealthy diet, refined carbohydrates and saturated fats, physical activity, increasing age, family history of diabetes, that is the genetic factors, hypertensions. So there are several hypertension medicines that contributes the diabetes. One of is the uh, diuretics, diuretics. So this contribute to the risk of uh, diabetes. So this is called is the hydrochlorothiazide. So another is the dyslipidemia. Smoking is another cause of the diabetes. Excessive alcohol consumptions is also causes of diabetes, and the chronic stress is the main cause of diabetes. So the common symptoms include in diabetes is frequent urinations, excessive thirst, increased hunger, unexplained weight loss, fatigue and weakness, blue-red vision, slow wounding healing, frequent infections, numbness or tingling in the hands and feet, dry mouth, and itch skin. So these are the common symptoms of the diabetes. So another factor contributing for cardiac related contributions, cardiac related problems is bad cholesterol. So bad cholesterol, significantly known as the low density lipoprotein cholesterol, is one of the major lipoprotein responsible for transporting cholesterol from the liver to various tissues throughout the body. Cholesterol is a waxy fat-like substance that is essential for several physiological processes, including the formations of cell membranes, productions of steroid hormones, synthesis of vitamin D, and formation of bile acids that aid in the fat digestion. Although cholesterol is necessary for normal blood body functions, excessive level of LDL cholesterol in the blood streams are harmful because promote the developments of cardiovascular disease. For this reason, LDL cholesterol is commonly referred as an bad cholesterol. So, one of the important questions, all of us, what is LDL cholesterol? ठीक है, आप बैठो, मेरा 10 मिनट बैठो, मैं बुलाता हूँ फिर लेक्चर. Low density lipoprotein is a type of lipoprotein composed of cholesterol, triglycerides, phospholipids, proteins. Its primary functions is to transport cholesterol from the liver to body tissue where it is needed to cellular growth and repair. Under normal physiological condition, LDL perform as an essential role in maintaining cellular functions. However, when LDL cholesterol level become excessive cholesterol accumulates within the wall of arteries, initiating the formation of fatty deposit known as atherosclerosis plaque. These plaque gradually narrow and harden of arteries in conditions called atherosclerosis, reducing blood flow through vital वो आया था उनको बैठा दो एक बार to vital organs such as heart, brain, and kidney. If a plaque ruptures, it can trigger the formations of blood clot that completely blocks blood flow, resulting in the heart attack or stroke. So what is the bad cholesterol? So bad cholesterol is called pani or coffee. Bad cholesterol called cholesterol because elevated concentrations increase the risk of cardiovascular disease, unlike high density lipoprotein, which removes excessive cholesterol from the bloodstream and transport it back to the liver of this for disposal. LDL delivers cholesterol to the tissues. When LDL practicals remains in the circulations for prolonged periods or become oxidized, they penetrates the arteries wall and contributes to plaque formations. So you can see here this is the plaque formations. So you can see here this is the plaque formations in the arteries of the heart. So more clear here that you can see in this slides. So this is the plaque formations. This is the form of LDL. LDL means the low density lipoproteins or in the forms of triglycerides. So this create a obstacle for blood flow in the arteries. So what is the causage? So now I would like to focus on the causage of the high LDL cholesterol, because high LDL cholesterol is not only build the fat deposit in blood arteries, but also this contributes to the atherosclerosis, means that hardening of arteries. If our arteries is hard, when difficult to blood pass, and automatically the blood pressures raise, and if the blood pressure is raised, then heart is damaged. So if the blood pressures high in long terms, this contributes to the heart attacks. So several factors contributes to increase LDL cholesterol level. One of the most important causes is an unhealthy diet rich in saturated fat, fats, and cholesterol. So frequent consumptions of processed foods, fried foods, fast food. So now there is a new trend. So the parcel food or Zomato. So there are several agencies that provide a food delivery in the home. So all these factors that contributes to high level LDL, low density cholesterols. So this is the enemy of our heart and contribute to the heart failure or the heart related problems. So red meat also, full fat dairy products also increase the LDL. Butter, bakery products. So bakery products is also dangerous because there is no water in the bakery products, and commercially prepared snacks increase LDL cholesterol level. So another factors that contributes LDL is the sedentary lifestyles. So physical inactivity reduces the body ability to regulate lipid metabolism, leading to increased LDL level and decrease HDL level. HDL means high density lipoproteins. So this is good for our health, but LDL is not good for health, not good for the arteries, because LDL with triglycerides, this form the plaque in the arteries and restrict blood flow in the arteries. So this contributes to the coronary artery disease of the heart. So another factors for LDL cholesterol is obesity, particularly excessive abnormal fat, is strongly associated with elevated LDL cholesterol. Excessive body weight alters lipid metabolism and promotes insulin resistance, increasing cardiovascular risk. Another factor is smoking. So smoking also damage our blood vessels. So this contribute to narrow our blood vessels, promotes LDL oxidations and lower HDL cholesterols, accelerating atherosclerosis. So those who are regular smokers, so his arteries is completely atherosclerosis, means hardening of the arteries of the heart and difficult to pass the blood smoothly. So another contributing factor is the uh, excessive alcohol consumptions can contribute to abnormal lipid levels and weight gains, indirectly increasing LDL cholesterol. So another factors is the genetic factors, including uh, uh, family history may causes markedly elevated LDL cholesterol even in individual who maintain healthy lifestyles. So other contributing factors for the LDL low density lipoprotein is increasing age, type 2 diabetes mellitus, hypothyroidism, chronic kidney disease, liver disease, because liver is a organs that produce lipid, and in some cases certain medications that increase the risk of formation of LDL. So risk factors include is the peoples with obesity, physically inactive individuals, smokers, individuals with diabetes mellitus, peoples with hypertension, those consumptions diet high in saturated and trans fats, older adults and individuals with the family history of hypercholesteremia or cardiovascular disease. So now I would like to focus on the health consequences of high LDL cholesterol. Though the most serious consequences of elevated LDL cholesterol is atherosclerosis. I a number of times repeated, atherosclerosis is hardening of the arteries within the heart. So most serious consequences for elevated LDL cholesterol is atherosclerosis, in which fatty plaque progressively narrow the arteries, reduce blood flow limits oxygen delivery to tissue, and increase the risk of several cardiovascular disease. So high LDL cholesterol significantly increase the risk of coronary arteries disease. Narrowing of the coronary arteries reduce blood supply to the heart muscles, causing chest pain and increasing the likelihood of heart attack. The another major complications is stroke, plaque formations in arteries. You can see in the previous slides. So supplying the brain, plaque supply by the brain may reduce cerebral blood flow or promote clot formation in the blood, resulting in ischemic stroke. So elevated LDL cholesterol also contribute to peripheral artery disease in the leg, reducing blood flow to the leg and causing pain during walking, poor wound healing, and severe cases of tissue damage. Persistence, elevations of LDL cholesterol increase the risk of hypertension because arterial stiffness and narrowing increase resistance to the blood flow. So long-term uncontrolled LDL cholesterol may contribute to heart failure, chronic kidney disease, and increase overall cardiovascular mortality. So I think this is a time of break. So already 1 hour 35 minutes is completed of these lectures. So I will continue remaining after a break. So I think 5 to 10 minutes break for you.
Yes, sir. Thank you.
Okay. So I will return on what time? After 10 minutes? Participants, I'm asking from you.
Yes, sir. Yes, sir. Yes, sir.
Right one 6:50, sir.
Yes, sir.
Okay, okay. So actually, I'm online. So you remind me. And if you remind me, I will continue this lecture. Okay?
Yes, sir.
Okay. Thank you. बोलिए सर आई
सगळ्यात पहिले सर अभिनंदन.
बस सर
मी नांदेडचा.
नांदेड अच्छा
हो
कुठलं?
आणि एसआरटी मधून माझं शिक्षण झालंय सगळं.
अच्छा खूप
श्रेयस मार्कंडे.
हाँ गर्म लेकर के जाओ पानी भी दे दीजिए ना ठीक है बहुत अच्छा जो है ना तो कैसे कब आए आप यहाँ पर नांदेड़ से
मैं एक्चुअली यहाँ सर लगभग 5-6 साल से यही हूँ दिल्ली में.
अच्छा
लेकिन मेरे जो कॉलेज एजुकेशन है सारा एसआरटी से ही हुआ है. बी मैकेनिकल इंजीनियरिंग.
अच्छा उसमें आपने क्या नाम है SGSS
एमजीएम नहीं, उदयगिरी इंजीनियरिंग कॉलेज.
अच्छा
लेकिन जब रेड्डी सर थे, मनोज रेड्डी सर, उनके टेन्योर में हमारा इंटर यूनिवर्सिटी टूर्नामेंट काफी खेलना हुआ.
वेरी कौन से खेल में खेले
2012 से लेकर के 16 तक.
अच्छा
हाँ
बहुत अच्छा वेरी गुड जो है ना
काफी अच्छा लगा आपको यहाँ देख करके.
थैंक यू
उस वक्त हमारा मिलना हुआ था जब हम स्टूडेंट्स थे, शायद आपको याद नहीं होगा, थोड़े थोड़े थे.
अच्छा नहीं ठीक है ना मिले
एक्चुअली हम अभी वर्ल्ड चैंपियनशिप में थे, तो उस वक्त हमें ये पता चला कि आपका डेपुटेशन यहाँ पे हुआ है, तो
अच्छा
काफी प्रसन्नता हुई. तो जैसे ही वहां से फ्री हुए.
अभी दिल्ली में कहाँ रह रहे हैं आप
जी
अभी दिल्ली में रह रहे हैं
हाँ, अभी दिल्ली में ही.
प्रियंका और गौरव को मिलो
द्वारका सेक्टर सर.
अच्छा अच्छा अच्छा
हाँ जी सर.
ठीक है अच्छा हो गया कि आप जो है ना मेरा वो चालू है 1 मिनट
ठीक है
हेलो
सर, मुझे कंफर्म करना था जो आपने इनविटेशन लेटर जो आपने नाम में भेजा
Hello?
हाँ यस
उनको 7 का भेजना है 8 का भेजना है
7 को
7
इन लोगों को 7 को भेज रहे
Hello.
हाँ
It
यस
is
यस हाँ कैन आई स्टार्ट
Yes, sir.
yes.
Yes, sir.
हाँ यस सर यस सर
मेरा वो आपको दिख रहा क्या स्लाइड्स
Yes,
स्लाइड
हाँ
sir.
यस सर
स्लाइड इज विजिबल
विजिबल
Yes.
सर
ओके ओके थोड़े कोलेस्ट्रॉल के बारे में और बोल लेते हैं सो व्हाट इज द सिम्टम्स ऑफ high LDL cholesterol so actually uh, high LDL cholesterol is often called is the silent conditions because it usually produces no symptoms until serious cardiovascular vascular complications develop. Many individuals remain unaware of the elevated cholesterol until they experience a heart attack, a stroke, or undergo routine blood testing. In severe inherited forms, visible signs such as cholesterol deposit in 10 of skins, etc., etc. So, the diagnosis of LDL cholesterol using a lipid profile in bloods. So, the components of cholesterol is to total cholesterol, LDL cholesterol, HDL cholesterol, and triglyceride cholesterols. So, most effective strategy for reducing cholesterol is a lifestyle modifications. A healthy diet emphasize fruits, vegetable, whole grains, nuts, fish, lean protein, and unsaturated fats helps lower LDL cholesterol. Saturated fats and trans fats should be minimized, while dietary fibers, particularly soluble fibers, helps reduce cholesterol absorptions. So regular physical activity, including at least 150 minutes of moderate intensity aerobic exercise per week, improve lipid metabolism and LDL cholesterol and raise LDL, HDL cholesterol. HDL is good for our health. Okay. So maintaining a healthy body weight, avoiding tobacco use, limiting alcohol intake, managing stress, and obtaining adequate sleep uh, all contribute to healthier cholesterol level. For individual at high cardiovascular risk or with persistently elevated LDL cholesterol, despite lifestyle changes, physician may prescribe cholesterol-lowering medications such as statins uh, and other blood pressures medicines. Also, so that is the telmisartans. So this also helps to reduce the LDL cholesterols. So in statins, so actually generally there are two types of statins. This is called is the rosuvastatin and the atorvastatins. So actually this medications so prescribed for the heart related problem or heart patients regularly though has either a stent angioplasty or a cardiac surgery. So, maintaining optimal LDL cholesterol levels reduce the risk of coronary artery disease, prevent heart attack and stroke, improve blood vessels health, reduce the progression of atherosclerosis, enhance overall cardiovascular health, increase life expectancies, improve quality of life, lower healthcare costs associated with cardiovascular disease. So finally, the bad cholesterol or low density cholesterol is essential for transporting cholesterol throughout the body, but excessive level are harmful because they promote atherosclerosis and cardiovascular disease. Elevated LDL cholesterol is one of the leading risk factors for heart attack, stroke, peripheral arterial disease, and premature death since high LDL cholesterol usually develop without symptoms. Or regular screening through lipid profile testing is essential, particularly for individuals with cardiovascular risk factors. A healthy lifestyle consisting of balanced nutrition, regular exercise, weight management, smoking cessations, and appropriate medical treatment when necessary remains the cornerstones or preventing and managing high LDL cholesterol and maintaining long-term cardiovascular health. So now, the smoking is another enemy of our heart. So actually, smoking is now very common in young populations. Even in the students, they often use cigarette. So this is not good for our heart. So this create more and more problem for the heart. So smoking consumptions of the leading preventable causes of disease, disability, and premature death worldwide. Both behavior and the major modifiable risk factors for numerous non-communicable disease, including cardiovascular disease, cancer, chronic respiratory disease, liver disorder, diabetes, and mental health problems. Although tobacco and alcohol are widely used in many societies, their harmful effects extend beyond the individual, affecting families, community, health systems, and national economics. Understanding the health consequences of smoking and alcohol consumptions is suggestions for promoting healthy lifestyle in preventing chronic disease. Smoking refers to the inhalation of smoke produced by burning tobacco products such as cigarette, cigars, BDs, and other tobacco containing products. Tobacco smoke contains more than 500 chemical substances, hundreds of which are toxic, and at least 100 non carcinogens. The primary addictive substance in tobacco is nicotine, which stimulates the central nervous system and creates physical and psychological dependence. When tobacco smoke enters the lungs, harmful chemicals rapidly enter the bloodstream and are transported throughout the body. These substances damage blood vessels, reduce oxygen delivery, increase inflammations, and impair the normal function of nearly every organ systems. Long-term smoking, accelerating aging, and substantially increase the risk of chronic disease. Smoking is one of the strongest risk factors for cardiovascular disease. It damages the inner lining of blood vessels. This is called as the endothelium. Promotes the formation of atherosclerosis, plaque, increase blood pressures, raise heart rate, and increase the tendency of blood to clot. So these changes significantly increase the risk of coronary artery disease, heart attack, stroke, peripheral artery disease, and sudden cardiac death or sudden cardiac attack. So smoking is one of the leading causes for lung cancer and contribute to cancer of the mouth, throat, esophagus, stomach, pancreas, liver, kidney, bladder, cervix, and colon. In addition, smoking is strongly associated with chronic respiratory disease such as chronic obstructive pulmonary disease, emphysema, and chronic bronchitis. Smokers frequently experiencing chronic cough, breathlessness, wheezing, and reduced lung functions. Beyond the cardiovascular or heart problems and respiratory systems, smokes weakens in immunity systems, delay wound healing, increase the risk of infections, contribute to osteoporosis, accelerates skin aging, causes tooth loss and gum disease, and reduce fertility in both men and women. Pregnant women who smoke are at increased risk of miscarriage, premature birth, low birth weight, and sudden infant's death syndrome. So secondhand, smoke also pose serious health risk. Non-smokers exposed to tobacco smoke are at increased risk of heart disease, lung cancer, asthma, and respiratory infections, particularly children and older adults. So now I would like to focus on the obesity. So obesity is one of the common problems in our society because the our lifestyle is sudden change. We playing with the social media, mobile phone, not go to the grounds, and we have less physical activities. So all these factors that increase the obesity, and obesity adversely impact in our heart. So obesity is the chronic metabolic disorders characterized by the excessive accumulations of body fat that adversely affect health. It is commonly assessed using the body mass index, uh, and obesity has become one of the most significant public health challenges worldwide due to the rapidly increasing prevalence and its strong associations with cardiovascular disease, diabetes mellitus, hypertension, and premature mortality. Excess body weight places considerable strain on the cardiovascular system, increasing the risk of developing various heart-related disorders. Consequently, obesity is recognized as one of the most important modifiable risk factors for cardiovascular disease. So the relationship between obesity and heart health. So actually, the heart functions continuously to pump blood throughout the body, supplying oxygen and nutrients to every organs. In individuals with obesity, the increased body mass require greater blood flow to meet the metabolic demands of excess adipose tissue. As a result, the heart must pump more blood, increasing cardiac output and workload. Over time, this persistent increase in workload leads to structural and functional changes in the heart, making obese individuals more susceptible for cardiovascular disease. So excessive fat also acts as an active endocrine organs and produce inflammatory substances known as adipokines and cytokines. Chronic inflammations damage blood vessels, promotes insulin resistance, and accelerates the development of atherosclerosis. In addition, obesity is frequently associated with hypertension, dyslipidemia, and type 2 diabetes mellitus, all of which further increase cardiovascular risk. So, one of the primary mechanisms through which obesity affects the heart by increasing blood pressure, excess adipose tissues stimulates and sympathetic nerve systems and activates the renin, angiotensins, aldosterone systems, leading to narrowing of blood vessels and increased sodium and water retentions. These changes elevate blood pressure and force that the heart is work harder to circulate blood. Obesity also contributes to the atherosclerosis in conditions in which fatty deposit accumulates within the wall of arteries, elevated level of low density lipoprotein cholesterol and triglyceride combined with reduced level of high density lipoprotein cholesterol promotes plaque formations. So these plaque narrow the coronary arteries, reducing blood flow to the heart and muscles and increase the risk of coronary artery disease. So insulin resistance, which commonly accompanies obesity, increase blood glucose level and damage blood vessels, elevated glucose and chronic inflammations accelerate vascular energy, increasing the likelihood of heart attack and stroke. So heart problem is associated with the obesity because coronary artery disease develop when the cholesterol-rich plaque narrow the coronary arteries supplying the heart, reduce blood flow, decrease oxygen delivery to the heart muscles, resulting in chest pain and increasing the risk of heart attack. Hypertension. So obesity is one of the leading causes of hypertension. Increasing body weight raises peripheral vascular resistance and blood volume, causing persistent elevations of blood pressures. Long-standing hypertension damage the heart, kidney, brain, and blood vessels. So obese individuals have substantially higher risk of heart attack due to accelerated atherosclerosis, hypertension, diabetes, and abnormal blood clotting. A rupture of the atherosclerosis plaque can completely block a chronic artery, causing permanent damage of the heart muscles. So here persistence obesity increase. So persistence obesity increase the heart workload, causing enlargement and thickening of the heart muscles. Eventually, the heart becomes unable to pump blood efficiently, resulting in heart failure. Symptoms include breathlessness, fatigue, swelling of the leg, and reduced exercise tolerance. Obesity increase the likelihood of abnormal heart rhythms, particularly atrial fibrillations due to enlargement of the heart chambers, inflammations and structural remodeling, arrhythmias, increasing the risk of stroke and heart failure. So obesity indirectly increase stroke risk by promoting hypertension, diabetes mellitus, dyslipidemia, and atherosclerosis, reduced blood flow or blood clot formations in cerebral arteries may result in ischemic stroke. So individuals with severe obesity have higher risk of sudden cardiac death because of underlying coronary arteries disease, arrhythmias, and structural heart abnormalities. So these are the risk factors of the major risk factor for the cardiac disease. I already discussed on the sedentary lifestyle, diabetes, blood pressures, obesity, bad cholesterol, smoking, too much alcohol drinking. Uh, so, so I would like to focus on the stress. So, stress and anxiety are the common psychological conditions that significantly influence cardiovascular health. While short-term stress is a normal physiological response that helps the body cope with challenging situations, chronic stress and persistent anxiety can have harmful effects on the heart and blood vessels. Increasing scientific evidence indicates that psychological stress is an independent risk factor for hypertension. In addition to contributing to the development of cardiovascular disease, stress and anxiety can worsen existing heart conditions and negatively affect recovery after a cardiac event. Therefore, understanding the relationship between psychological health and cardiovascular disease is essential for preventing heart-related complications and promoting overall well-being. So, stress is the body physical and emotional response to internal or external challenges known as stressors. These stressors may include work pressure, financial difficulty, family conflict, academic demand, illness, and major life events. So, when an individual experiencing stress, the body enters the fight or flight response. During this response, the heart beat faster, blood pressure raises, and blood vessels constrict to increase blood flow to essential organs and muscles. While these changes are beneficial during short-term emergencies, prolonged activations of the stress response places continuous strain on the cardiovascular system. So repeated elevations of the heart rate and blood pressure increase the workload of the heart. Chronic exposure to stress hormones. So this is called is the cortisols damage the inner lining of blood vessels, promotes inflammations and accelerate the formations of atherosclerosis plaque. Elevated cortisol levels also contribute to insulin resistance, obesity, abdominal fat accumulations, and abnormal cholesterol level, all of which increase cardiovascular risk. Stress and anxiety may also influence blood clotting by increasing platelet activations, making blood more likely to clot. This increases the risk of coronary arteries uh, blockage and the acute myocardial uh, infections. So these are the types of heart disease. So you can see here in the pictures in the slides. So there are several reasons for the uh, mm, mm, heart related disease. I also shown you. I also discussed about my lectures. So some of the cardiac disease. So these are the types of coronary heart disease. You can see here. So this is called is the cardiovascular cerebrovascular stroke. So you can see in these pictures. So actually this artery is situated in the brain. Okay. So this is called is the cerebral arteries. So this is the part of the brain, over part of the brain. So this picture is inside inside the cerebral arteries. You can see here. So here is the blockage in the forms of LDL or triglycerides. So we talk much about on the triglycerides. So these can create a problem to pass the blood smoothly in the brain, and this is causes of stroke. So a stroke means the bleeding in the brain, and sometimes stroke is severe, then the death is occur. So risk factors for the plaque. So is that also include the chronic occupational stress, family history, depressions, anxiety, smoking, excessive alcohol consumptions, obesity, physical inactivity means the individual cannot engage in any physical activities or sporting activities, diabetes mellitus, especially the type 2 diabetes, is also one of the risk factor for the cerebral artery disease. Another thing is the hypertension. So hypertension is also increase the risk. So hypertension is one of the reasons for contributing factors of atherosclerosis in the arteries. So this is situated in the brain, but this comes under the cardiac disease. Okay, because this is the arteries, and all arteries comes under the heart. So you can see here. So this is the another cardiac disease. So heart disease also known as the cardiovascular disease. I also told you in my previous slides. So is the collective terms used to describe a group of disorders that affect heart and blood vessels associated with it. The heart functions continuously to pump oxygen-rich blood through the body, supplying essential nutrients and oxygens to every organs and tissue. Any conditions that interferes with the normal structures of functions of the heart can impair blood circulations and increase ठीक है and increase the risk of heart disease. So heart disease may develop due to the already I told you, so aging, unhealthy lifestyle habits, obesity, etc., etc. So coronary artery disease is the most common forms of artery disease. So this is the, you can see here, this is the normal arteries, okay, and this is the narrowing arteries. So this come under is the coronary artery disease. So this is the most common from the heart disease. So this is more prevalent in most common heart disease. It's developed when the coronary arteries become narrow or blocked because the accumulation of cholesterol rich fatty plaque within the arteries. You can see here. So this is the cholesterol rich lipid is deposit in the arteries. As the arteries narrows, blood flow to the heart muscles decrease, reduce the supply of oxygens and nutrients. These conditions may cause chest pain, reduced physical capacity, shortness of breath, and eventually a heart attack if the artery become completely blocked. A heart attack, medically known as a myocardial infarction, I already told you, occurs when the blood flow to the portions of the heart muscles is suddenly interrupted due to the complete blockage of the coronary arteries. You can see here. So this is called the blockage. Okay. So without adequate oxygen, the affected heart muscles begins to die. A heart attack is the medical emergency that require immediate treatment to restore blood flow and minimize permanent damage of the heart. So common manifestations include severe chest pain radiating to the left arm, neck, back, sweating, nausea, breathlessness, and dizziness. So cardiopathy. So this is the. So heart failure is the another major types of heart disease, in which the heart become unable to pump sufficient blood to meet the body metabolic demands. Heart failure developed gradually and often result from long-standing hypertension, chronic artery disease, previous heart attack, cardiomyopathy, or valvular disease. Individuals with the heart disease commonly experience fatigue, shortness of breath, swelling of leg, reduced exercise tolerance, and fluid accumulations in the lungs or other body tissues. So, hypertensive heart disease develop the consequences of prolonged high blood pressures, persistent elevation of blood pressure forces the heart or work harder in order to pump blood throughout the body. Over the time, peripheral. Rheumatic heart disease. So now I would like to focus on the rheumatic heart disease. So rheumatic heart disease develops as the complications of untreated streptococcal throat infections, which may progress of rheumatic fevers. The inflammatory process associated with rheumatic fevers damage the heart valves, particularly the mitral valve. So progressive valve damage interferes with normal blood flow throughout the heart and increase the risk of heart failure, arrhythmias, and ineffective endocarditis. Rheumatic heart disease remains the important causes of cardiovascular morbidity in many developed countries. So myocarditis is characterized by inflammation of the heart muscles. Viral infections represents the most common causes, although bacterial infections, autoimmune disorders, and certain medications may also produce myocarditis. Inflammations, weakness, and heart muscles and impairs the ability to pump blood efficiently. Severe case may result in heart failure, arrhythmias, and sudden cardiac death. So this is the peripheral artery disease. So so actually this disease mainly occur in the leg. So you can see here. So this occur in the legs. Okay. So this is the normal arteries, and this is the abnormal arteries. This is the narrowed atherosclerotic arteries in which blood cannot be passed easily, smoothly, and characterized by the pain in the legs. So here actually this is occurs in morely in the left side, but this also prevent the supply of blood to the heart. So here this is called is the peripheral artery disease. So here we can say that peripheral artery disease which result from narrowing the artery supply to the blood to the limbs, although peripheral artery disease primarily affects the legs, it reflects widespread atherosclerosis throughout the body and significantly increase the risk of coronary artery disease, heart attack, and strokes. So these various forms of heart disease frequently share common risk factors, including hypertension, diabetes mellitus, obesity, dyslipidemia, smoking, excessive alcohol consumption, sedentary lifestyle, chronic stress, unhealthy dietary habits, increased age, and family history of the cardiovascular disease. Many heart disease develop gradually over several years before symptoms become apparent, emphasizing the importance of regular medical evaluations and early detection. So, heart disease can largely be prevented through healthy lifestyle practice such as regular physical activity, consumption of balanced diet, maintenance of healthy body weight, smoking cessations, uh, moderate to alcohol intake of alcohol, effective stress management, adequate sleep, and routine medical screening. Early diagnosis, namely treatment and long-term management of the cardiovascular risk factors, significantly reduce morbidity and mortality associated with the heart disease. So finally, heart disease encompasses a wide spectrum of disorders affecting the coronary arteries, heart muscles, valve, uh, electrical conductions, system, and surrounding tissues, coronary artery disease, heart attack, heart failure, arrhythmias, cardiomyopathy, valvular heart disease, congenital heart disease, rheumatic heart disease, myocarditis, peripheral disease, and endocarditis represents the principal types of heart disease. Understanding these conditions and their underlying mechanism is essential for improving cardiovascular health, preventing complications, and enhancing longevity and quality of life. So, actually, this is very difficult for the heart attack. It is difficult. So, in the morning, so there is a more and more cases reported by the heart attack by the patients. So, how can we handle the heart attack in our house? So, actually, in the morning sessions, so heart attack occurs more and more at 60 to 80% peoples. They suffered in heart attack or heart related problem in the morning, even in the cardiac arrest means that the dead of the people. Okay. So, oh, my video is not ready, I think. Hello? अभी वीडियो दिखाई दे रहा है? हेलो हेलो हेलो
यस सर यस सर
हाँ सर दिखाई दे रहा है।
पहले नहीं दे रहा था अभी, ठीक है ना? अभी आपको स्लाइड दिखाई दे रहा है? So you can
हाँ
see
यस
the
सर
slide?
यस।
हो सर
Okay, okay. So how many participants in this course? Can you tell me total number of participants? Hello.
Yes, sir.
How many participants in this course?
Sir, 34.
34, but only 19
Yes, sir.
participants joined.
36.
Okay.
36.
No,
36.
no problems. So
34.
how you manage the heart attack in the home? Okay. In which medicines you take to you survive from heart attack? So I will discuss. So there are a combination of 3 medicines. So if you use, then you save your life in your home or in the workplace or in the any public place, because so the distance between home and hospital is far, even those who are lucky, so home with near to the hospitals. So if heart attack occurs, so I also told you the symptoms. So heart attack, so means they are sweating, chest pain, especially in the left side, left hand pain, neck pain, jaw pain, vomiting. All these are the symptoms of the heart attack. And if your heart attack is occur, then 80 to 90% cases, your blood pressure is raised. So you keep the digital blood pressure monitor. No need to go to the doctors, approach to the doctors for measuring your blood pressures. So if you feel these conditions, that is vomiting, sweating, chest pain, back pain, headache, you can check the blood pressures. If your blood pressure is raised, so it may be the heart attack. So you can take a disprin. So actually, cardiovascular disease, including coronary artery disease, heart attack, stroke, and peripheral arterial disease are among the leading cause of morbidity and mortality worldwide. The medical management of these conditions involve lifestyle modifications together with the pharmacological therapy aimed at reducing cardiovascular risk, preventing blood clot formations, lowering cholesterol level, and improving long-term survival. Among the most commonly prescribed cardiovascular medicines are aspirin. Okay, so disprin is one type of aspirin, statin, and clopidogrel. These medications play distinct but complementary roles in the prevent and treatment of cardiovascular disease or heart attack. Their use should always be based on the physician because they have specific indications, contradictions, and potential adverse effects. So disprin is a brand of aspirin. Aspirin belongs to the class of drugs known as antiplatelet agents. Platelets are blood cells responsible for forming blood clots. When blood vessels are injured in cardiovascular disease, platelets may also contribute to the formations of clot within narrow arteries, leading to heart attack or stroke. Aspirin work by irreversibly inhibiting the uh, uh, cyclooxygenes 1 enzyme, thereby reducing the productions of thromboxane A, a chemical that promotes platelet aggregating and blood vessels constrictions. As a result, platelets became less likely to stick together and form harmful clots. Low dose aspirin is widely used for secondary preventions, meaning it helps prevent another heart attack or stroke in individuals who have already experienced one. It is commonly prescribed after coronary artery stenting, coronary artery bypass graft surgery, and in patient with established coronary artery disease or peripheral artery disease. However, aspirin is not routinely recommended for primary preventions in all healthy adults because the potential reductions in heart attack and stroke risk must be balanced against the increased risk of serious bleeding, particularly gastrointestinal bleeding and hemorrhagic stroke. Current clinical guidelines recommend individualized assessment before initiating aspirin therapy for primary prevention. Another thing is the common adverse effect, including stomach irritations, gastritis, peptic ulcer disease, gastrointestinal bleeding, allergic reactions, and increased bleeding tendency. Patients should take aspirin only under medical supervision, especially if they have history of ulcer, bleeding disorders, concurrent use of anticoagulant medications. So another medicines. So this is the 325 mg of aspirins. So this is the antiplatelets medicines, and this is helpful to survive from the heart attack. One. So playing. So another medicine is the statins. So statins in the forms of atorvastatin and the rosuvastatin. So एक मिनट. हाँ सर बोलिए. हेलो 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 सर बोलिए. ये ठीक है. और कौन है वहां पर रात में? हाँ ठीक है, आ जाओ, कोई बात नहीं. ठीक है, ओके ओके. हाँ बनवा लीजिए. ठीक है ना. ओके. सॉरी फॉर इंटरप्शंस. So statin is another medicines you can take with 325 mg disprin with 80 mg of atorvastatin or 40 mg of rosuvastatin. So actually, this is the cholesterol lowering medications that inhibits the enzyme 3 hydroxy 3 methylglutari 1 coenzyme reduces which play a central role in cholesterol synthesis within the liver. The reducing cholesterol productions statins lower density lipoprotein cholesterol, commonly referred to the bad cholesterol. So LDL cholesterol reduces the progression of atherosclerosis, the process in which cholesterol-rich plaque accumulate within arterial walls. Statin also stabilize existing plaque, making them less likely to rupture and trigger heart attack or stroke. In addition to lowering cholesterol, statin possesses anti-inflammatory properties, improve endothelial functions, reduce oxidative stress, and enhance vascular health. So statin are prescribed for individuals with established cardiovascular disease, diabetes mellitus, familiar hypercholesterolemia, elevated LDL cholesterol, or high estimated cardiovascular risk. They are considered one of the most effective medications for reducing the risk of heart attack, stroke, and cardiovascular mortality. Commonly prescribed statin includes atorvastatin, rosuvastatin, simvastatin, paravastatin, and pitavastatin. Although statins are generally well tolerated, some individual may experience muscle pain, muscle weakness, mild elevation of liver enzyme, or rarely severe muscle injury. Regular monitoring of liver function and clinical assessment of the muscle symptoms may be appropriated in selected patients. So another medicines you can use during the heart attack in home. So colpitagral 300 mg. So actually, the highest dose of 150 in markets. So you can take 150 tablets for colpitagral. Okay. So this is the another important antiplatelets medicines. So both are the antiplatelet medicines. Aspirin is also antiplatelets medicines. So this use of the cardiovascular medicines, unlike aspirin, colbitegral inhibits platelets aggressions by blocking the PYY2 adenosine D4 diphosphate receptor on platelet surface. This prevent platelet activations and reduce the formation of arterial blood clots. So colpitagral is commonly prescribed after acute coronary syndrome, including unstable angina and myocardial infections, as well as after coronary artery stent implementations. It is frequently used together with low dose aspirin, a combination known as a dual antiplatelet therapy to prevent clot formations within coronary stents and reduce recurrent cardiovascular events. So, colpitagral is also indicated for patients with previous ischemic stroke, peripheral arterial disease, or those who are unable to tolerate aspirin because of allergy or gastrointestinal intolerance. The peripheral adverse effect of colpitagral is an increased risk of bleeding. Patient may experience prolonged bleeding from cuts, e.g., bruising, nose bleeds, gastrointestinal bleeding, serious bleeding, complications, and uncommon with require prompt medical attentions. So here, aspirin, statin, and colpitagral are often aspirin, statin, and colpitagral are often prescribed together because they act throughout different mechanisms and provide complementary discover protections. So statin reduce cholesterol level, stabilize atherosclerosis plaque, and slow disease progression. Aspirin reduce platelet aggregations and decrease the likelihood of blood clot formations. Colpitagral provide additional platelets inhibitions, particularly after coronary stenting or acute coronary syndromes. So this combination significantly used to survive from a heart attack. So after taking of these three medicines, that is disprin, uh, uh, statin, and colbitegral, you can uh, approach the hospitals after heart attack, and you tell to the doctors, so I have taken this life saving loading dose. In some cases, sorbitrate 5 mg is also used. So this is also helpful to survive from the heart attack, but this is a short term effect. So the mechanism is different for work other than disprin, ectrova, and colpitagral. So sorbitrates, this is the nitrate oxide, and nitrate oxide vasodilate the blood vessels, and if the blood vessels is vasodilated, blood is smoothly pass through coronary and prevent the heart attack. So actually, these medicines should only be taken under the supervision or qualified healthcare professional. But in the morning time, so there is no medicals, no doctors available. You can ask from the phone. You can communicate with the doctor in the morning, or even if case is serious, you can also use this and save from the heart attack. So here, so finally we can say that aspirin, statin, and clopidogrel are among the most important medications used in the preventing the management of cardiovascular disease. Aspirin and clopidogrel reduces platelet aggregations and lower the risk of harmful blood clot formations, while uh, reduces LDL cholesterol, stabilize atherosclerosis plaque, and improve vascular health. So this is the prevention of heart disease. So sporting in physical activities that improve your cardiac ejection fractions. So this is important because this is the pumping ability of the heart. So if the pumping ability is 50 to 75%, means your heart is the normal. So if the heart is 36 to 49%, heart pumping ability is below normal, and below 35% ability is low. So this is the serious conditions of the heart patient. So this is the sign of low ejection fractions. This is the fatigue, shortness of breath, swelling in the feet, rapid pulse or heart rate, and the abnormal pulses. So you can see in these slides. So so how the left ventricular hypertrophy. So this is the conditions. Whereas the mm, heart is not pump blood uh, adequate amount through left ventricular. So all of you know very well. So the pure blood pumped through the left ventricular. This is the part of the heart, and uh, heart is supply the blood to the entire body with nutrients and the oxygen supply. So here is the two figures before all of you. So this is the normal heart you can see here, and another is the abnormal heart or the hypertrophic left ventricular you can see here. So in the red, so where is the pure blood is available, and in the blue, this is the impure blood. So you can see here the hypertrophic left ventriculars, where the area of the left ventricular is reduced due to the hypertrophy, and these conditions, either the feeling the shortness of breath or pain in the chest, this is called as the angina. So if those who are regular engaged in exercise or sporting activity, they can reduce the risk of left ventricular hypertrophy, because this is the serious types of heart disease. So the symptoms of the left ventricular hypertrophy is include the shortness of breath, fatigue, chest pain, often after exercising, sensation of rapid fluttering or pounding heartbeats, and dizziness or fainting. So this is the another types of heart disease. So this is the valve related heart disease. You can see here. One picture is the normal heart, another is the abnormal heart. So this is the mitral valve stenosis. Stenosis means the narrow the valve. If you narrow the valve, then blood cannot flow properly in the heart, and heart attacks may be occur. So this is the aortic stenosis, heart-related disease. You can see here, this is the normal heart, and this is the aortic stenosis, where the valve is narrowing. So other benefits of the exercise and physical exercise for vasodilation of blood vessels. Vasodilation means the diameter of the blood vessels is increased. If the diameter of blood vessels is increased, blood easily pass through the body and the heart, the less pressure in heart due to the vasodilations. So another is the stroke volume increase. Stroke volume means the amount of blood pumped by the left ventricular in one stroke. Means that the normal people, so healthy peoples that uh, pump of blood in 70 milliliter in one stroke. So this is called is the stroke volume. Another is the cardiac output. Cardiac output means the blood pump in 1 minute from the heart. Okay. So in case of male, so 4 to 5 liters blood pumped in a minute, and in case of female, so 3 to 4 liters blood pumped in a minute. So all these things, other benefits is improve the heart rate and maintain the blood pressures. So another thing after the exercise, so food and fruits also essential for the good heart health. Garlic. So actually, garlic is very important because garlic can help reduce hypertension in increasing amount of nitric oxide in the body. Nitric oxide helps promote vasodilations or widening of arteries to reduce blood pressures, and this is also helpful to reduce the clot of blood in the arteries and survive from the heart attack. So actually, garlic is good for health. You can take 1 to 2 cloves in the morning in with 1 glass of waters. So this is also improve your immunity systems. This improve your digestive systems. So there are so many benefits as per the literature of Ayurveda. There are more than 2000 benefits of garlic use if you take in the morning with 1 glass of water. So this is the fruits. This includes the nuts or the potassium. So potassium is also helpful for the arteries and the blood pressures and also in the heart related pressures, because potassium is dilate your blood pressures and blood vessels and helpful to manage blood pressures. So this is the fish. So although uh, fish is very important, very beneficial for heart, but in nowadays, so fish is not recommended because fish include oil, and this is increase the low density cholesterol, LDL and VLDL, and also is the triglyceride. But if you use or if you eat fish without oil, so it can be helpful to you because the omega-3 fatty acid is present in fish, and omega-3 fatty acid is also helpful your heart because heart is made up by the cardiac muscles, and omega-3 fatty acid strengthen the cardiac muscles by its property of elasticity and stretchabilities. So thank you very much. So now I invite you for the questions and answer sessions. So if you have any questions, so please do not hesitate. You ask me.
हेलो सर
Participants, any questions?
हेलो
Yes.
सर जिनको थायराइड है सर वो भी गार्लिक खा सकते हैं कि सुबह सुबह?
हाँ मैडम, गार्लिक इज गुड फॉर द थायराइड्स. ओके.
ओके
लेकिन खाली पेट खाना है उसको. और
ओके
शुरुआती में तो आपको 2-3 दिन दिक्कत होगी. इनिशियली यू कैन फेस प्रॉब्लम्स इन 2 to 3 days. सो इट में गैस्ट्रिक्स. ओके. So
Okay, sir.
it may create acidity, but after 2 to 3 days, it is normalized.
Okay, sir. Thank you, sir.
Another questions from your side? Hello?
हाँ सर।
Yes, sir.
एक ही प्रकार के ऑयल खाने से कोलेस्ट्रॉल बढ़ता है, ऐसा होता है क्या सर? क्या
हाँ, yes, yes.
रोटेशन में खाना चाहिए क्या?
ऑयल खाने से कोलेस्ट्रॉल बढ़ता ही बढ़ता है, ठीक है ना?
एक ही प्रकार का ऑयल खाने से?
नहीं, एक ही नहीं, सभी
लंबे
प्रकार के
समय?
ऑयल में सरसों में कम होते हैं थोड़े से, बाकी जो हम दूसरे ऑयल खाते हैं, ठीक है ना?
हाँ हाँ।
और पाम ऑयल्स वगैरह, उसमें कोलेस्ट्रॉल बढ़ते बढ़ते जो है ना, ठीक है ना? फैट्स बढ़ते हैं तो कोलेस्ट्रॉल भी बढ़ेंगे ना। फैट्स और कोलेस्ट्रॉल दोनों एक दूसरे के जो है सो पूरक है,
हाँ।
बोथ आर वाइस वर्सा। ओके,
ओके।
if your fats is increased, then your low LDL and triglyceride is increased, and this contribute to the heart attack. This contribute to blockage in the arteries.
तो हम रोटेशन में खा सकते हैं,
रोटेशन
15 दिन एक प्रकार का,
आप रोटेशन खाइए,
फिर
फ्रूट्स
15 दिन
खाइए।
अलग प्रकार का?
नहीं, उसको आप काउंटर करने के लिए फ्रूट्स खाइए, डेली एक्सरसाइज कीजिए, ठीक है ना? वेट कंट्रोल करके रखिए, अच्छी चीज खाइए जो है ना, ठीक है? हरी सब्जियां खाइए जो है ना, दाल दाल का सेवन अच्छे से कीजिए, नट्स जो बताया आप नट्स खाइए, ठीक है ना? साइट्रिक फ्रूट्स खाइए, तो इससे जो है सो कंट्रोल रहेगा आपका।
ओके, थैंक यू सर, थैंक यू।
ओके, एनी क्वेश्चंस? हेलो? हेलो? हेलो?
नो क्वेश्चन सर।
नो क्वेश्चंस? कैन आई लीव विद द परमिशन?
No, sir, just a minute for vote of thanks, sir.
ओके ओके।
Yes, on behalf of UGC Malviya Mission, Teacher Training Center, Dr. Baba Saheb Ambedkar, Marathwada University, Chhatrapati Shivajinagar, I have the privilege of proposing the vote of thanks. We extend our gratitude to our today's speaker,
हैं?
Dr.
लो।
S.K. Singh, for delivering such an informative and inspiring session on cardiac health and wellness, causes and remedies. Your valuable insights into the causes of heart disease, risk factors, preventive measures, then healthy lifestyle with regular exercise have greatly increased our awareness. Your presentation with PPT and pictures have motivated all of us to take better care of our health. Thank you, sir. Thank you, everyone.
Can I leave?
Yes, sir.